Dr. Coletti, Baywest Health Rehab. We are going to a little crack-a-lackin' with Jennifer. She's having a lot of discomfort in her upper shoulders, lower neck region, having some headaches, and we're going to perform the Manipuflex procedure today. But I'm going to kind of go through an overview, opening up the whole entire spine with our flexion distraction. For those of you, some of you chiropractors that follow me, the Lloyd table, the 402 auto flexion, it is, in my opinion, the best. And the reason why I say that is because ever since I had this table, my patient visit average went from here to here because the patients just got better quicker and faster. So at first I thought to myself, well, this table is costing me money, but actually I got more referrals from it. So we're going to start off with Jennifer. We're going to open up her spine. She's about 4 foot, what, 4'11", Jennifer?
5. Don't cut me short.
5 foot tall. We're going to probably bring her up till about 5'2". They say it's another thing that as physicians we cannot do is promise that we're going to gain 2 inches of height. My mama always said, don't ever let the truth get in the way of a good story. All right, so as you can see, it's flexion distraction. We're going to distract a little bit. We are going to do a little genie rub first to just loosen up. A lot of patients will ask me, well, doc, what does this actually do? And I tell them truthfully nothing, but it feels good. So, seriousness, the genie rub helps to just open up the tissue, lets it relax. And a lot of times when patients will help them just kind of let their muscles kind of just soothe. From time to time, though, we'll get a few patients that will say, it bothers me or it itches. I don't do a whole lot of it, just ever so briefly. Okay. Is that okay, Jennifer?
Yeah.
All right, Miss Jenny. Okay, now we do a little lateral flexion with this, and I'm going to distract a little bit more. You can see that really just opens up the spine a little bit, which prior to the Manipuflex, when I flip her over at a few, really will help to open up the entire spine, not only from the neck region, but through the mid-upper back and even down to the lumbars. And as I do this, and as I palpate through the lumbar spine, I can find little spots of tenderness. Now, if you're a patient watching this and you've never seen this, my intentions are what some might seem is just kind of a laid-back attitude that I have with patients, but really chiropractic, it's not going to hurt you. It's not going to hurt you. It's very relaxed, and you'd have nothing to worry about. So do not hesitate if you're not local and you're just on my feed and channel. Go see a chiropractor. Give them a chance. Okay. So I think we're about good and tidied up there. What I like to do is with Jennifer, she gets really tight through her pelvis and through her hip flexors and quadriceps. We're going to stretch those a little bit. And like I tell most patients, that's not supposed to tickle, right, Jenny?
No.
But it does open up the tissue, helps loosen up the pelvis. Good. One of the best things one can do when you're having lower back discomfort, stretch your quadriceps, stretch your hamstrings. 2 of the best stretches you can do. And you don't need a chiropractor or a doctor or give me any money to do so. Every morning, make a good habit of actually doing just some small stretches. Follow just your hamstrings and quads and the legs, and then just some arm circles and upper and lower neck stretches. I mean, we all brush our teeth in the morning, and that takes some of us maybe a minute or two. If you kind of created a habit of stretching just like that, like you brush your teeth, you'd have less musculoskeletal problems, and then therefore less degeneration, less inflammation, less overall pain and discomfort. Okay. Now we're going to just drop that. I like to open up to a little hip loosey-goose for me. Good, more. Good. Little hip distraction. This is where we get that extra 2 inches. Right, Jen?
Yes.
Okay. And then I'm going to Do a little light drop. Loose. A little loud, can be a little intimidating, but this drop technique allows me to set the bones and pelvis in motion. Table stops, bones keep moving. Relax. All right, Jen, I'm just going to do a little P to A here. Arms all the way down. We're not going to go too far and high up there. Breathe in and let it go. Good. Good. All right, now we're going to get you to flip over. I'm going to all the way down. This is where I'm going to grab my wedge. Place it underneath your legs. Up, Jen. Good. Scoot your body up the table a little bit. Typically, with such pretty women like Jennifer, I like to have them put their pretty hair up in a bun, but I don't know if she has one today. Watch your bottom so I don't squish it. Good. Now I'm going to take my straps. And see if you can come in here, you can get a couple different angles here if you would. You don't have to come too close, but we'll just strap in there. We're going to strap in here. This really helps me to stabilize the pelvis. So when I do my neck traction on her, you feel kind of locked in there, hon?
Yes.
Okay. Okay. And my little towel warmer. Oh. Now we're going to grab my trusty towel. Isn't that amazing how it works? As you can see, she's got her legs elevated, which helps to flatten out the lower spine. So when I do the tractioning of the neck region, it's going to really open up her spine. And this is very hot. Which is good because, Jen, aren't you kind of hot?
Yep.
Okay, good. Lift your head up, down. Good. Is that too warm or is that okay?
No, it's fine.
All right, good. It's actually a little hot on me, actually. And there. Okay. Now that she's all strapped in, we're going to just kind of open up, loose, and breathe in. Let it all the way out, Miss Jen. Good. Good. More. Good. Ah, that's what we call a Yahtzee. Can you move your fingers?
I can't.
Can you bring your thumbs up? Okay, how far down did we feel that move?
Right, all the way down.
All the way down. She is clearly at least 2 inches taller. I like to just unloosen this so she can breathe in her waist now. And then I'm just going to motion now into her neck. A little bit. Relax. More. Good. Let it fall. Good. Let it fall. Oh, good. And good. Dr. Coletti, Jennifer, Manipuflex, we are out.